Sure, and Denise sort of hit on it, and I want to cover our community investment agreements also require the EOA project partners to invest in the training and development programs that we've been able to leverage with partners at the table, whether it's Camden County College, the Union Organization for Social Services, and others. Again, because government is restricted on the funding that we have, we know what the needs are. I know that we need to have workforce development programs for our residents, for the adults, but also looking at what do we do differently for our youth. Because as Rick mentioned, every child is not going from cradle to college to career. Some children are going to go from cradle to career and then maybe college, which quite frankly was my story coming out of high school. And we're looking at how we retool one of our public high schools, our traditional public high schools, as a career and technical education academy. And so, you know, looking at the industry forecasts with employers that are in the region and what their expectations and what they're going to be hiring for in the future is where we want to start training our young people and creating that pipeline so that they're eligible to work in the medical field or to work in, you know, urban planning. A lot of our children are underexposed, and a lot of the parents and grandparents have been underexposed. So I'll just use the example of myself. I'll put myself out there. Although I came from a two-parent household, I was raised by my grandparents, I wanted to be a fashion designer. But had I known about urban planning, which I found out about, you know, as I got more involved in government and in community organizing and community planning with a Hope 6 when I was a councilwoman, I would have done that differently. My grandmother said, you're going to get a job in government because you're going to starve to death as a fashion designer. So that's really how I landed in government. But again, I think exposing our young people to careers that are maybe what they think out of their reach, but then also showing them the pathway or how they achieve that dream and that goal. The other benefit we have in Camden is we have a very active eds and meds collaborative and task force. And just last year, and I know we've talked a lot about construction jobs, but let me go to the health sciences field. Just last year, we launched a career training program for medical assistants in collaboration with our not high schools, but our hospitals, Cooper University Hospital, Our Lady of Lourdes, and Virtua. Again, exposing young people to careers in the healthcare industry. And many of them that went through that program started with a job, $30,000, which is not bad for someone 19 years old, plus health benefits and a pension. So, you know, having a quality job looks very much like, you know, making sure you have access to health benefits, which is priceless, but also having retirement options and having those conversations with our residents. So